When a person loses hair, 97% there's a family history of hair loss, a gene in the family. And if you inherit that gene, which could be up to 3 generations above you, parents, grandparents, great-grandparents, the gene once inherited, you can lose hair. Hair loss is in the front and the center of the head. Nobody loses at the back of the head. The hair at the back are permanent, and if you take hair from there and plant it anywhere, head, forehead, nose, cheeks, eyebrow, mustache, anywhere, they will stay for life, grow like normal hair, need haircuts, never fall, comb them, oil them, shampoo them, they are permanent hair. Only 2 medicines work in hair loss, which can control hair loss, slow down hair loss, improve the quality of the existing hair, but they do not grow new hair. The primary treatment for any hair loss patient is use medicines, at least for 6 months. If medicines revive the hair which are falling to make them better, it's good. But in case you've lost hair, especially in the area in the front where medicines don't work, the only option is doing a hair transplant. There are 2 techniques of doing a hair transplant. The strip technique, also known as FUT and FUE. I'll explain both to you. In the strip technique, we take a strip of permanent hair, including the roots and its skin from the back. Suppose I take a strip from here, about half a centimeter wide. When I take a strip, there will be a gap, there will be a wound, there will be a raw area. We stitch it up. It's only a line. There is no gap left. The line is covered the rest of the hair. You cannot see any gap visible at all, even immediately after the surgery, and it's not visible unless you shave your head. The other technique is called FUE. What we do in FUE, here the hair sticking off the skin, we take a punch, go along the shaft of the hair, go through and try and pull out the hair along its root. It's a blind technique. You don't see below the skin. Because it's a blind technique, there's a possibility of cutting the hair root if there's a damage of 5 to 30% degree in the angle of the introduction. So the hair loss is more in a FUE technique than a strip where you're seeing under a microscope, under magnification, and the loss is only 1 to 3%. The second difference in strip and FUE, in FUE, you have to shave the head because I need to see the small hair from which I can take out the hair roots. In strip, you don't shave your head. But unfortunately in India, nobody shaves the head unless there's a bereavement in the family. So it takes about 3 months for the hair to grow back. People know you had something done to your head, but in a strip, the moment you go out, nobody sees from where the hair had been taken. Thirdly, the best area for taking hair in the hair transplant is the center of the head, about a centimeter above the upper part of the ear to around the ear itself. In this zone, when I take a strip, I can take all the best hair. In an FUE, I take 1 hair, I leave 2. I take 1 hair, I leave 2. So the yield from that area will be little less than an FUT. Whatever you get in FUT, in FUE, it's going to be only about 50% or even less at times. The scarring is actually more in FUE than FUT. It's a wrong publicity being made. In FUT, there's a fine linear scar, special technique of pore closure called trichophytic closure. Hair grow through the scar. You don't see the scar unless you shave your head. Scar of say 30 centimeter wide, 0.2 millimeter, the scar's surface area will be 60 square, whatever. In FUE, if I do 2000 punches, you'll see 2000 dots like a Chinese checkerboard. And if you multiply that area even by a 0.9 mm punch, 0.9 mm into 2 pi r square, as you know, the area, into 2000 is much more than that of a strip. Fourthly, there's another important, very important point. In FUT, we are cutting under magnification. The grafts are thicker, chubbier, more amount of tissue. The chance to the stem cell damage is less. In FUE, it's a blind technique. You're just putting the punch and taking it out. Asian hair, Indian hair is much thicker than Caucasian hair. There's a chance that the punch might damage the stem cell on the shaft of the hair. And if it is damaged, then the hair grow for 3-4 years and do not grow back again. So you'll see many patients have an FUT done and they grow hair for a while, but it falls off, it doesn't come back after 2, 3, 4, 5 years. Good example, I did Shasti in 2006, Arunlal 2007, Harsha Bhut 2008, Lakshman 2009, Pathan in 2011. They all still have their intact hair, all did a strip. Sehwag did an FUE in 2009. In 2011, he lost 80% of his hair. Anup Jalota did a hair transplant in 2016. By 2019, he lost a majority of his hair. Our film star Alok Nath did a hair transplant in 2021 and lost a good amount of it by 23. Why that? Wayne Rooney, the famous footballer from England, did a hair transplant in 2015. He lost a significant amount in a couple of years and into a second sitting. I do both the techniques. I have done more than 8,000 hair transplants till now, starting 1995-96. It's your choice. Whatever you want, we'll do. Of course, for a large area, we usually combine strip and FUE. If you use the scalp, it right from the beard as well to get more yield and cover a maximal area if possible. To do a surgery, you have to do a blood test, show the reports, make a deposit to fix a date of surgery, and then you come on the day of surgery, do the surgery, just totally under local anesthesia, awake throughout the procedure, listening to music, watching television, at the break you have your lunch, and go home right after the operation, and even go back to work in a day or two. So if you have a problem with hair loss, and you're finding it difficult to live happily with that baldness, come to us, we'll solve your problem permanently and give you a new look with new crop of hair.